welcome to part 3 of our series on the client meeting. And this is a really important piece to the puzzle that we've been putting together here over the course of weeks as we've been working on this series. But we're diving into this concept of how we can walk through a compliant and productive client meeting. In our very first session, in part 1, we went over the actual basics of what we would want to do before we ever have a meeting. Things like getting the scope of appointment form. Things like having the conversation with our clients about what they're going to need to bring to the meeting with them. And we talked through that in part 1. Part 2, we went over the basics of Medicare Part A and Part B. We talked about how we can look at Medicare Supplement plan options for our clients. We talked about keeping track of that premium for the Medicare Supplement plan so we can compare that to what we're going to talk about today. And so we're going to spend our entire time here in this third part in TLC's exclusive enrollment platform called Smart Enroll. If you do not have this yet, you're a new agent, you cannot get access to Smart Enroll until TLC has received a report from the carrier or from a carrier that says that you are indeed ready to sell with that carrier. And so if you ever log into Smart Enroll and you're not seeing a carrier that you think you should have, that would probably be why. We're probably not showing that you're ready to sell yet with that carrier, which is going to cause them not to appear in your tool. So for our purposes today, let's dive in and start to take a look at how we can then go from that Medicare Supplement presentation. Again, we've shown the different plan options. Maybe we've shown Plan N and Plan G. We've explained to them the difference between regular Plan G, Select Plan G, Innovative Plan G. And if you don't know what I'm talking about with all these different supplement options, please go back and watch part 2 of this series. There are now a lot more different varieties of supplement plans. So our next step would be, we've gone over that Medicare Supplement plan option. We're going to come to Smart Enroll now. And ideally, we've already created this beneficiary profile all the way back before the client meeting. When we did part 1 of this series, we talked about the value in doing this before we ever have a meeting. And obviously, the best piece to that is we're going to have our compliance scope of appointment form. But in case you missed that piece and you're just joining us for this section today, I do want to show you how to create a profile in Smart Enroll. It's pretty easy. So when you're at your dashboard page, this is where you're going to be when you first log in. In the top right, you're going to click New Profile, and then you're going to click New Beneficiary. It's going to bring you to a screen that looks just like this. You're going to go ahead and plug in a zip code. I'm going to go ahead and do somewhere in Pennsylvania today. I always do Ohio, but let's go to PA today. You put the zip code in. You're going to put your client's name in. I'm just going to make one up. Joe Smith. Probably none of those out there, right? You have to put their date of birth in. So I'm going to go ahead with March. We'll do March 1st. And we're going to do 1957. Now, I'm not going to do this today, but in that part 1 training, I talked about the importance of adding an email address and the primary phone number and mobile number when you create these beneficiaries. Let me go ahead and just add a phone number just for good measure. And so that will give me the ability to text the scope of appointment, but you would also want to add the email address. You would also want to add the home address at the time of creating the beneficiary, because that saves your client steps when they go to complete your scope of appointment form. It also ensures that you're maintaining that information for your client and not losing it. So I'm going to go ahead and click Save. And then if they have an MBI, a Medicare Beneficiary ID number, identification number, I can enter that here along with their Part A and B effective date, and I can check eligibility. On all of these enrollment platforms, this is a fantastic tool when it works. There are times where the connection to the federal database is not active and this is not as effective, but we do have this here, and when it works, it's great. It will tell you if they are on a current plan if you use this search tool. We can also do a Medicaid eligibility check down here at the bottom. And then at the very bottom of their profile screen, you will see any quote and enrollment history that you've completed with that individual. So that's the basics of creating a profile. Let's now segue into where we need to be today. So let's go to continue to SOA. That stands for scope of appointment, of course. If you missed our segment 1 where we talked about how to do this, please go back and take a look at it. I'm not going to demonstrate it today. So I'm assuming that we've already done this. We've already sent the scope of appointment. It's already come back to us, and we've already signed it as an agent. We're going to add preferences. So Smart Enroll and now even Medicare.gov now have the ability to add providers to your search. The search tool is very easy to use. You simply start typing a name. I'm going to go ahead and add Greg Johnson. And I'm going to indicate that that is my primary physician. And then it's going to ask this question, are you a new patient for that provider? I'm going to go ahead and click add. And now I've added my first doctor to the search. So we can continue to go through this step by step, adding the doctors that our client has. Now here is the disclaimer. If I'm adding doctors using the Smart Enroll provider search, this is for screening purposes only. For me, as an agent, as a trainer, my recommendation is trust but verify. It is a good search tool, but there is no perfect search tool. And the best thing you can do for your client is to always, at that final point before you enroll them into a Medicare Advantage plan, always go ahead and check the provider network from the carrier-specific site, which I'm going to show you how to do here today. So I'm going to spend some time adding providers, and then I'm going to spend some time adding pharmacies. Now, Smart Enroll will allow me to add up to 3 pharmacies. So I'm going to add CVS, and I'm going to go ahead and add Walgreens, and then I'm going to go ahead and add Wegmans, which is an Erie supermarket. So it's going to allow me to add 3, and at the bottom, it's going to give me a question I want my drug cost to be based on, and I can pick any of those 3 pharmacies, or I can choose mail order. Now, what if they want to compare more than 3 pharmacies? Well, you would have to first run the comparison using these 3 plus mail order, and you could come back and take 1 or 2 out and add additional pharmacies, where Medicare.gov will allow you to add more than 3 pharmacies. Next up, extremely important, we have to add medications. We talked about ways to do this in our first part of this 4-part series. My favorite is to have their actual prescriptions in hand, where I can go ahead and look at those and make sure that I'm getting everything accurate. That is my preference. But if you don't have those medication bottles, hopefully you told them to bring a list, which is what we trained you to do in the first part. If all else fails, they come to you with no list, no pill bottles. You still have options. You can always go ahead and call their pharmacy with them. And that's not a bad way to go. You can call their pharmacy and find out what medications they have that way. You can also sometimes log into My Chart with them if they have that app on their phone and they know how to get into it. I've done that numerous times. The only downside is both the pharmacy and My Chart can have prescriptions listed that they're no longer taking. So you got to be careful with that. But I think we're pretty good for now. We're going to go ahead and add a couple medications. We'll add a basic statin drug for cholesterol. Very common, atorvastatin. When I type that in, it's going to bring up a bunch of fill-in-the-blank choices. And then I have to pick the dosage. So let's assume that my client's on the standard dosage, which is 10 milligrams. Smart Enroll, when you enter medication, will almost always go to the standard dosage. So it will always go to the standard dosage for every medication. at least from what I've seen. I'm going to go ahead and click add. And we know a statin drug, a blood pressure pill for the most part, thyroid medications for the most part are generally low-cost medications. There will be some individuals, though. Let's do this one right here. We're going to add levothyroxine, okay? And that is a medication for the thyroid. You will see on my screen there are two varieties, a capsule and a tablet. It is hugely important that we know which our client is taking. There are some medications, this being one of them, where the capsule is very expensive and the tablet is very inexpensive. So we don't want to make mistakes, like clerical mistakes in our meetings that make our clients panic unduly, right? So I'm going to go ahead and click the tablet version of this, and then we can go ahead and pick the dosage, okay? Now, I am typing in generic drug names. Atorvastatin is a generic drug. Levothyroxine sodium is a generic drug. You will come across clients who actually need to take the brand name. And so you might actually have to type in Lipitor, and you can see I'm going to have 10 milligrams, and it's going to ask me, would you like a generic version of Lipitor, which is that first medication we entered? And I'm going to have to go ahead and pick no, because maybe my client can only benefit from the generic. And really where we tend to see that most commonly is with these thyroid drugs. So your client may have a thyroid drug that they have to take the brand name for. Make sure to enter that accurately if that is the case. And if they're giving you a medication list and it states the brand name, always ask if it's okay to enter the generic. Don't just assume, okay? So there's a couple of medications. We're going to go ahead and add, let's add a couple of expensive ones here just for fun. Let's add Ozempic. And you will see the various forms that I can get Ozempic in. I'm going to go ahead and add the standard dosage. And we will add one more here. Let's do Jardiance. A common drug for a lot of our clients. So we'll add that in. And so we would continue this for as long as we needed to based on our client's individual medication list. I'm not going to get into this today, but there are medications that come in a large variety of forms. They could be a cream, an ointment, a gel, an eye drop, a capsule, an injection. So you do have to take your time, and you do have to make sure that you know what version of those medications your client is using. I've never done this. I've had people say it works pretty well, but if your client has a mymedicare.gov account and they have already connected their medications within that account, they've looked them up, they've searched, they've added their pharmacy, you can send an email to them at the email address they used for their Medicare.gov account, and they can link it back to Smart Enroll, and all this work will be magically done for you. However, if you try that and it works as well as I've heard it has, always, again, trust but verify. Let's say, thank you for letting me import your medication list. Let's go over this one more time together to make sure everything looks good. And we'll talk about why in a moment. So I can close this now. I've added prescriptions. And we have 4 other blocks here on the preference screen. I'm not going to get into those today, except for one. This trainings series that we're doing is focused on people that are really turning 65. It's that client meeting for somebody who's new to Medicare. But if this is a review, I can click Add Current Plan. And if I wasn't able to find their current plan with their Medicare ID number back when we showed you that on their profile, I can manually enter a Medicare drug plan or a Medicare Advantage prescription drug plan. And I'll do it just for good measure so we can see what it looks like later. I'll just grab the first plan. We'll do Aetna, and we'll call it the Aetna Advantage or Premier. And now I've added their current plan. That will allow that to be shown on the next screen. So we're going to go ahead now and click Continue to Plans. So let's back up to where we're at in the process. We've already gotten our scope of appointment form. We're in our meeting. As we went over in session 2, we've talked about Medicare Supplement plan options. Those, for reminder, are right here on this tab marked Medicare Supplement plan. Okay. And so if I show someone a Medicare Supplement plan, I also need to make sure in the next step that I show them what would go along with that. So here I have the ability to show them a prescription drug plan. And as you can see in this zip code, it's only showing 2 plans, 2 prescription drug plans available. And they're both from HealthSprings. And they both come with a premium. And the reason is these are the only 2 plans in that area that are going to pay me a commission. So in fairness to my client, I can totally write one of these if this is the best option. But if I want to, I can come up here and click Add Non-Commissionable Plans. And I can click Add Non-Licensed Plans. And that will show every plan available in that area, which are 12. And what I like to show, I wish this was the default setting, but when we do a sort, in particular when we're looking at prescription plans, we care about premium, which is the default sort mechanism over here. But what I really want to know is their total estimated cost. So I'm going to go ahead and click Total Estimated Cost, and it's going to sort the plans in order based on total monthly premium and then total annual cost, which is premium plus estimated medication pricing at the pharmacy. When you are using this tool, unless I change it, it will always be showing starting the first of the next month through the end of the calendar year. So at the time that we're making this recording in 2026, we are in February. So this estimated drug cost right here is from March 1st until the end of the calendar year at CVS Pharmacy for these 4 medications that I went ahead and entered. And so what I like to do is, first and foremost, we can see that this is non-commissionable. I'm going to go ahead and click Add to Compare. And then you'll see the next plan in terms of total estimated cost is considerably more expensive. We have $123.60 a month by way of premium. Then we have a total annual cost of $1,852. So for my client to go on a drug plan that would pay me a commission, they would be spending over $800 more for the remainder of the year. I don't really feel good about that. If it was $50, $80, $100, I would definitely make the case that yes, this plan is going to cost you more, but transparently, that comes with the advantage of having me as an agent in your corner and helping you advocate with that carrier because I'm actually licensed and I can be your agent on that plan. It's okay to say that. It's okay to share your value and the cost of your value. And some people are going to say, you know what? Yeah, I want to have you as my agent. I'll pay the extra $50. And some people are going to say, you know what? I appreciate it. I'm fine making all those phone calls and dealing with customer service on my own. Have that authentic conversation with them and you can never go wrong. Okay. So now we know, I'm not going to get into plan details here because we're going to see this. We're going to be able to get into it on the Medicare Advantage plan anyway, and it's going to be the same. But we now have a Medicare Supplement plan option, and we know what it would cost my client to have a standalone drug plan option. So $8.20 a month, estimated drug cost at CVS. I'll show you how to compare the other pharmacies when we get into Med Advantage. Roughly $945 out of pocket for the remainder of the calendar year. We're not going to get into this during our training today, but we will have additional trainings coming up that talk about other pieces that we can put with a Medicare Supplement plan pathway. So it's your plan G or N or whatever plan they want, plus the standalone drug plan, plus dental and vision. And here at TLC, we have an exclusive dental and vision product through Emeritus. If you're not contracted with that, please reach out to our marketing team, marketing@tlcinsurancegroup.com. Not only can you quote individuals with that exclusive product to supplement this Medicare supplement coverage, you can go in and quote entire companies, up to 100 employees on your own and beyond that with our assistant. So for now, let's segue over to Med Advantage to show the other pathway. We've shown Med Sup plus standalone PDP, and hopefully we're contracted and we can show dental and vision. If you don't know how to do that, come back to our training on dental and vision. We now want to take a look at Medicare Advantage. Be very cautious here if you're a new agent. Some of you that are listening to this live have quite a lot of experience behind you and you already know this. But I've seen new agents inadvertently enroll an individual who's new to Medicare into a Medicare Advantage plan. The problem with that is Medicare Advantage plans, as they're listed in Smart Enroll, do not have prescription coverage. Think about that. They do not have prescription coverage. So if you don't catch it within 63 days and your client doesn't have any other creditable drug coverage, they start to accrue the LEP, the late enrollment penalty for Part D. So these Medicare Advantage only plans are specifically designed in most parts for veterans, people that get the majority of their care, including all of their medications through the VA. And so that's why these MA only plans typically have military names. You can see here the Highmark plan is called the Valor. Okay. Here's the UPMC Salute. There's the Aetna Eagle. There's the United Healthcare Patriot. Humana had a plan called the Honor. There it is, the Honor Give Back Plan. The WellCare Patriot Give Back Plan. A lot of these plans also have a give back amount for Part B, again, to help the veterans. So be conscientious of that. Only enroll somebody in a Medicare Advantage only plan if that's genuinely what you intend to do. For our purposes, let's segue over to Medicare Advantage prescription drug plans, MAPD, right? I've already done the work of adding the medications. Total disclaimer here. In order to effectively quote people on Medicare Advantage plans, you absolutely must do market research. Absolutely must do market research. I'm going to show you a way before we get off here at the very end how to make that simple. But if you do not know specifics about Medicare Advantage plans, no quoting tool can truly help you make those determinations for your clients. And there are too many for you to just kind of fumble through the search. Like right now, there's 73 in this zip code. But if I do market research, if I attend carrier rollouts, I will identify very quickly 4, 5, maybe 6 plans in my area that in almost every case are going to be the top contenders. This is why in the summer months when we do the carrier trainings and then when we start to go to those carrier rollouts, every single year in the counties that I work, I have created a spreadsheet that compares the plan benefits, and I go through and I rate the winners and losers. I highlight the columns of the high and low plans. Okay. And so looking at this, my first go-to when I get into Medicare Advantage plan shopping is still to go to the sort and still to break the plans down by total estimated cost. because for some people, that will be the most expensive factor. We have many, many, many clients who are very healthy. However, they have a lot of medications. And so we still want to see that in total cost. You can see here, because I added their current plan back in preferences, it's showing as at the top of the list. But this is a new client. I can go through and see all these different plans. You're going to notice right now that the first plan that comes up is a chronic special needs plan, a CSNP. And the second plan that comes up is a DSNP, dual special needs plan. I'm going to go to filters. And because my client does not qualify for dual plans, they're not on Medicaid, and they don't have a chronic condition, I'm going to go ahead and hide all special needs plans. Right? I'm going to click apply. And then from there, I should see the most cost-effective plan, and I do. So that current plan that I just kind of chose for demonstration, this worked out really well, was $29 a month, and it was $23.25 for the rest of the year for their medication. Where this Humana plan is $0 a month, and it's $360 for their medications for the rest of the year. But it does have an $8,000 max out of pocket. Okay, so that may or may not be the best choice. We'll go ahead and add that to compare. I'm going to add their current plan to the compare. Let's look a little further here. All right. You can see I'm looking at the max out of pockets. We have $7,950, we have $5,800, $8,300. Oh, here's Highmark Blue. Okay, $5,500, $840 for the medications. Let's add this one to the compare. So there's a lot of variables that we have to know, right? We're looking at Medicare Advantage plans right now based on drug cost and total cost. But what about the network? How strong is the HMO network if that's what we're looking at? What about the max out of pocket? What about dental, vision, hearing? How much is the primary care visit to specialist visit? Kind of need to know some of that by doing market research. But for now, I'm going to go ahead to the compare, and I'm going to be able to see some of that side by side. And the key word is some. Okay. So here's the current plan in column 1, Aetna. Here is the Humana PPO. Here is the Highmark HMO. I do get asked about this routinely, so let's just talk about PPO HMO for one moment. An HMO is a network-based plan. And in a network-based plan, I have to get all of my care for the most part through the network. Increasingly, carriers have added the POS name to their HMO, and that stands for point of service, and that in almost every case pertains to the dental and allows them to get some or all of their dental care beyond the network. But for the most part, if I'm on an HMO plan, I'm getting my care through a network provider. Okay? If I'm on a PPO plan, preferred physician organization, HMO, health maintenance organization. If I'm on a PPO plan, I have a network. I have to go to that network provider. And if I do that, I'm going to get the best cost in my plan. I'm going to get the preferred physician cost. Where if I go outside of the network, I'm going to pay a higher cost, probably co-insurance. And so the key about PPOs, though, is just because I have the ability to go outside the network doesn't mean every provider has to accept the insurance. So I can go outside of the network, but it's up to that provider to choose whether or not they want to take me as a patient. Now, many do. Many take major carrier PPO coverage, but there are some that may not. So you got to be careful with that. You never want to tell your client that just because you have a PPO, you can go anywhere you want and have coverage. It's not necessarily true. So while we're here on this comparison screen, we have estimated drug cost pops up in this first column. It's based on those 4 drugs that we added. And we have the annual cost, which is importantly up here, effective from March 26, 2026. You can change this. So there's a little pencil right here. If my client is aging in April, I can go ahead and pick April, and you're going to see the numbers behind this change. Watch. Okay. And there we go. So there's our April number. We can also toggle now between the pharmacies. We can go to Walgreens. And we can watch these numbers and see if they change. Let's go to Wegmans. Let's try mail order. So we have, again, CVS. The lowest is $360. That's that middle plan. Walgreens, still that middle plan at $360. Wegmans, still that middle plan at $360. Mail order, that middle plan, but $240. Now, it's not always the case. In fact, probably not typically the case these days that mail order is always the better route to go. But with the medications that we're doing for our demonstration today, it does look like mail order is very cost effective. We're going from $360 down to $240. That may be worth doing the mail order, right? We can now start looking at coverage details. So the middle plan has the lowest drug cost, but look at the max out of pocket. It's $8,000. Very high. We're over here, $5,500 and $5,500 on the current plan and the Highmark plan. Office visits, all 3 plans are $0. Specialist visits, $30, $45 on that PPO in the middle, $35 over here on Highmark. Let's take a look at the ER. $130, $115, $130. Not a huge discrepancy between the plans, right? Hospital stays, $379 for the entire stay. Pretty interesting, right? One-time payment, $379, doesn't matter how many days you're there. In the middle, $475 per day, days 1, 2, 3, 4, 5. So all 5 days, you're making a payment for $475 each day. Highmark, similar but cheaper than that, $220, days 1, 2, 3, 4, and 5. These hospital numbers are why we typically recommend a hospital indemnity plan to go along with a Medicare Advantage plan. If you're not familiar with those products or how to incorporate them into your presentation to help your clients, we will be doing another training on that. Please tune in to learn more. Now, here's the catch. Yes, this middle plan has an $8,000 MOOP, right? An $8,000 max out of pocket. But Humana will pay $1,100 of that individual's Part B premium throughout the year. I'm sorry, $110 per month, not $1,100. So we have $1,320 in Part B premium assistance on that plan. So you have to take that into account. The middle plan has the lowest medication pricing, and that individual is going to get a Part B gift back every month. Plus, if they go to the primary care doctor, it's $0. This is what I mean. These Medicare Advantage plans are so nuanced that we have to do market research. We have to have our own spreadsheet so that we can understand the specific details of the plans and know the clear winners in our area. So here's the medications near the bottom. Here's the pharmacies. It shows whether they're in network or not. High, low rated pharmacies. We could have standard pricing. We could have preferred pricing, as you see here. And then at the bottom, if you click on view details for any plan, let me go back for a second. At the very, very, very bottom, view details for any plan, it will take you to the plan specific screen, okay? There's another way that you can get there. And that would be at the top. You can click View Plan Details. And while we were doing this recording, someone asked in the chat, does TLC have a comparison spreadsheet? I have a template that we can share, but there is no way humanly possible that we can make comparisons for every market because it's zip code based. So it does take time. It is something that we have to do as agents. We have to do the market research. We have to dive into the plan details. And so while we're looking at the specifics of this Humana plan, where do we get such details? Well, Smart Enroll gives you this breakdown by way of an overview. You can see all the different coverage items are charted out here for us. But what I like, and I'm scrolling quickly because I want to show you this. We used to have to either download a book, order a book from the carrier site. Sometimes they were hard to find, quite honestly. Look at how Smart Enroll lays out this information for you. Within each plan's details, we have a link to the provider directory for that carrier. Go back to what I said previously. Let's assume that I'm an agent. I've done my market research. My client wants this Humana Give Back plan. I can now click this and it will open the provider directory on Humana's website. And I can go ahead and verify that their providers are indeed in network. Awesome. I used to have to keep that link somewhere. Now it's always going to be in Smart Enroll for that carrier. Maybe they're not on a medication, but through my presentation and through our meeting, they say they might be given a medication that they want to find out what tier it would be in. I can click here under any plan and be directed to a prescription search for that formulary. Amazing opportunity to check for that client and not have to go anywhere else. Pharmacy directory. I can look up any pharmacy for that carrier, again by name. And it's going to tell me that Walmart is a standard in-network pharmacy. And then down at the bottom, my favorite part. Plan documents are nestled right here for me. The summary of benefits is the essential document that we do our market research regarding. So here's the summary of benefits for that give back plan. For now, I'm just going to download it because I said I was going to show you something really cool at the end of this session. I'm going to download that to my computer. And we're going to come back to that. But this is so nice to have this. I can open it up and share my screen and go over the entire summary of benefits with my client before we do the enrollment. And all of the plan information is going to be here. You can see how detailed it is. And it's charted out in a way that's very easy to go over. The dental coverage is something that's not very good in the Smart Enroll breakdown. So it's nice to be able to get in here and see specifics on the dental coverage. Same with vision. And that's all linked for us right in here, which is amazing. We also have the EOC. So for every single Medicare Advantage plan, there is an evidence of coverage guide. These are big. This is 204 pages. But if your client asks you something out of the ordinary, you can just search this PDF, or we'll do it real quick. Let's try dental. I can search by dental. I can search by keywords and try to track down what it is that my client's asking me a question about. And here's all the information on diabetics. So this gets very detailed and specific on coverage items. I mean, here's what they do for an EKG screening, emergency care. So if your client's asking you, again, those questions that are a little off the wall, this evidence of coverage is where we want to go. All right. I love this too. Those of you that are watching this who are veteran agents, they started now giving us a copy of the annual notice of changes letter. Boy, is this helpful because we can see what our clients are getting by way of communication about changes to their plan. So I love having access to these. Back on track though, we've done our comparison. My client likes this plan. And I want to show them a little more details. I said I wasn't going to show you this on the standalone drug plans because I would show you it later. Now is the time. Let's look at these other tabs under the plan detail screen. If I click on prescriptions, it will show me by this plan what tier my client's medications are going to be placed in. So we have the statin medications right here. And so you can see that that is a tier 1 preferred generic. We have the levothyroxine, which is a tier 1, and it will show me the retail cost of the drug, first and foremost, then how much that medication cost in the initial coverage stage, and then how much that medication cost in the catastrophic stage after my clients met that $2,100 in covered medications for 2026. I can see I have no tier 2s. I have 2 tier 3s. You can see these are more costly, right? $611.76 retail, $60 in the initial coverage, $0 catastrophic. Look at Ozempic. $28.36 retail, $60 in the initial coverage stage. I can then also look at the total estimated cost. This is my favorite tab for medication pricing. It will show me month to month from April 1st, because that's the date that I picked for effective. Again, I could change that to March if I so choose. How much my clients should expect to pay at CVS each month. $30 for Jardiance, $30 for Ozempic. So you can see in September, my client doesn't pay any more money. Well, the math is not mathing, right? $2,100 out-of-pocket limit for Part D drugs, Part D covered drugs. Why is my client only spending $360? Because there are now other cost factors like there used to be before that go into meeting that $2,100. And so some of my clients' medications are going to contribute towards that $2,100, even though they're not paying that much every in total. So September, October, November, December, it's going to say catastrophic across the board. My client doesn't have to pay anything for those medications. The key thing here is this is an estimate. While usually very accurate, things happen. Pharmacies can have incorrect pricing. Databases can be wrong. We're sharing really good quality data here, but we want to make sure to never say this is exactly what you're going to pay. This is the estimate, okay? And so what we've achieved now, we've walked through the Med Supp pricing. We've walked through the PDP pricing. We've honed in on a Medicare Advantage plan potentially. And my client should have a good idea of the difference between those two pathways and what their cost might look like, both in terms of premium and out of pocket for their prescription medication. Once they make a decision, we're ready to go ahead and do the enrollment. If my client chooses to do a Medicare Supplement plan and a standalone Part D, you're going to need to do the Medicare Supplement plan application on the carrier website. If you try to do it in Smart Enroll, that's fine, but it's just going to connect you to the carrier website anyway. And the reason for that is Medicare Supplement plan applications are complex and lengthy, so they don't really integrate very well with enrollment software. If it is a Medicare Advantage plan, all I have to do is click Add to Cart. For most carriers, there are some that do not platform with us on Smart Enroll. And my client is with me. We can help them fill that application out right here and now. And at that point, it is literally reading the directions on the screen. I wanted to show you this though, because I love the fact that Smart Enroll is equipped with so many good checklists for compliance. Remember, for Med Advantage plans, we do have to review the summary of benefits before completing enrollment. Smart Enroll gives you a nice overview of those benefits here. Check marked for the disclaimers that you have to go over with your client. And once we fill this out, we get into a pretty darn straightforward application. Very basic. Showing it to you here. And the standalone drug plan application is identical. So once you check through that disclaimer list, we're going to have contact information, eligibility information, other, which is demographic, payment information, statement of understanding that they sign off on, and then they review and submit their application. And so that's pretty much how we get to that point, and we do that enrollment. If I'm doing a Medicare Advantage plan, I only have to do that one application, and again, maybe an indemnity, which we'll talk about in another training, maybe extra dental and vision, depending on their plan. If I do a Medicare Supplement plan pathway, we're doing the Medicare Supplement plan application. We're coming into Smart Enroll to do a standalone drug plan application, probably dental and vision, and it's a little more intensive to do all those applications, truly. But we want to do a good job outlining those pathways for our clients and making sure that they understand what is available to them. I'm not going to show it today because I want to show you this last little tip. But if you go to tlcagenthub.com, we have a very nice infographic that we've created that will allow you to kind of highlight some of the major differences between Medicare Supplement plans and Medicare Advantage plans. It just talks about some things like premium, network accessibility, simpleness for usage, and so on and so forth. You may want to go grab that infographic off of tlcagenthub.com if you would like. Okay? For now, let me show you this. So I told you there's a way to maybe escalate your plan comparisons now. And I want to hide the special needs plans again. And I'm just going to go ahead and download a couple of these summary of benefits. I already downloaded one earlier, if you recall. I'm going to download two more. And we'll go ahead and grab this one. Right. Now, what I can do is I can go to ChatGPT. And I can go ahead and say, make me a comparison spreadsheet detailing the benefits in these plans. I can click the plus and I can upload those three summaries of benefit. It's going to take a moment for those to upload, but this is, again, not going to be perfect, but it gets you really far down the road in doing a task that used to take hours. And so this can give you a really good head start in making that spreadsheet and doing those different comparisons. It will give me a downloadable spreadsheet, but you can already see ChatGPT charting out the different coverage amounts. Now I have a side-to-side comparison. Boy, what a great resource to us as agents. Okay. So while this continues to compute, a couple of things to think about when you look at Medicare Advantage plans in particular. Number one, how important is it to your client to have larger than a local network access? Do they have health conditions that would maybe require them to go to a major medical center like the Cleveland Clinic or UPMC? Is your client someone that travels quite a bit, who maybe spends time in Florida for half of the year or more? Is your client someone who has a strong genetic history of a complex condition and may have to even go to a research hospital like Vanderbilt or Mount Sinai or the Mayo Clinic? Are they comfortable living in a network? Where do you live and reside and when I say you, I mean them, and what is the access to quality care? If I live in the middle of nowhere in some state in the country that's extremely rural, and there's only one or two good hospitals and they're in other states, I might not even really have a plan, an Advantage plan that has a good network. And this is where the market research is so critical. Every single year during AEP, or leading into AEP, I should say, I do a training on how to create that spreadsheet for MAPDs. How to take a template that we have, use tools like ChatGPT, and how to go in and evaluate those options. So that's something that we can all do together. And late August, once all the plan information is available for 2027. But it is an essential step that we have to take as agents. And to a certain degree, the same is true for Med Supps. I typically show people how to use MyQuote. That is another tool available on TLC Agent Hub. It shows us with Medicare Supplement plans, how long has that plan been in market? How many insureds does that plan have? What is the loss ratio for that plan? What is the historic rate increase data for that plan? And these are all things that we're going to continue to teach you to help you be really good research-based, highly knowledgeable, and effective agents. We have one more part in this series. This part is going to cover what we do after the meeting. Come on back for that session. We're going to be talking about things like how we follow up. We're actually working on a new resource here for you to give to your clients after the meeting. We want to set the stage for what they should expect. We want to set the stage for us to be their go-to resource, not the carrier, and we'll talk about why in part 4. So whether you're watching this live or on YouTube or in our online course, make sure to check out part 4 of this series where we get into the specifics of the things that we recommend doing after the enrollment.